The SKylaRk trial was a phase 2 study of Isatuximab, Carfilzomib, Lenalidomide, Dexamethasone in newly diagnosed transplant-eligible patients with multiple myeloma. That data was published earlier this year in Lancet Hematology. But the question that we wanted to answer for this ad hoc abstract was, most of the patients in that study, 88%, deferred transplant. All the patients collected, but a large percent deferred. And one of the important questions in myeloma is whether or not to transplant. And so what we looked at now that we have a little bit more mature data was the outcomes of patients by cytogenetic risk. And what we saw is that the standard risk patients did very comparably well to other trials that included transplant. But where there was a small population, and these were very small numbers, about 5 patients who had double hits, who had 2 high-risk cytogenetic abnormalities, we did see that the progression-free survival was lower than that, than what was seen in the concept study that used the same regimen in high-risk patients but did incorporate transplant. And so we think it really begs the question of whether there may be some consideration of whether it be transplant or maybe CAR T-cell or adjunctive therapies in patients who do have high-risk disease to consolidate and ensure enhanced progression-free survival.